Welcome to everyone with us here this morning or this afternoon, depending on where you are. I'm Nancy Birdsall. I'm the former president of the Center for Global Development and now senior fellow. And I'm delighted to hear the large number of people who are listening in today. CGD is hosting this event with the Global Fund, and special thanks to Shuju Teble Haimanot and Alex Winch there, and as well to the amazing CGD events and communications team. This past April, South Africa's president, Cyril Ramaphosa, who is chair of the African Union, appointed 4 special envoys to mobilize international support for African countries facing the costs of COVID-19, not just the health costs and the pressures on health systems now and in the long run, but of course the economic costs, the fallout from the COVID itself in terms of the decline in GDP and the problems of lives and livelihoods on the continent as a result of COVID. Today we have 3 of the 4 special envoys to discuss the implications of the COVID: social, economic, financial, debt, decline in GDP, and to share with us their hopes and their progress, hopefully, for more vigorous support from the international community to Africa and Africa's people. We also have Larry Summers, who is chair of the Center for Global Development Board, to share in that discussion with them, perhaps to comment on what they have to say. To start off, we're very pleased to welcome South Africa's Minister of Health, Zwelini Mkhize, who is speaking on behalf of President Ramaphosa. And following the minister, also from the African Union, Amira El Fadil, who is the AU's Commissioner for Social Affairs. I hope the 2 of them will set the stage for us. Then we'll move on and have 20 to 30 minutes for comments and discussions among our 3 special envoys and Larry Summers. I'm just going to name them now. You all know their bios or can look at their bios. We have a lot of ministers, a lot of very distinguished, thoughtful people, former ministers. We have Donald Kaberuka, Trevor Manuel, Tijan Tiam, and of course, Larry Summers. Following discussion and interchange among the 3 special envoys and Larry Summers, we'll have about 20 to 30 minutes for audience questions. And please use the chat function on YouTube to submit your questions, or you can use Twitter with the hashtag CGD Talks, or you can send questions by email to events@cgdev.org. Now, let me turn over the floor, so to speak, to Minister Mkhize for your introductions, or for helping us set the stage, or to hear from the African Union from Chair Ramaphosa.
Thank you very much, Ms. Nancy Birdsall, the President Emeritus and Senior Fellow of the Center for Global Development. And special greetings to all the panelists. Excellency Amira El Fadil, Commissioner for Social Affairs, African Union. Dr. Donald Kaberuka, Chairperson of the Global Fund and member of the Special AU Envoys. Minister Trevor Manuel, also Special Envoy and former Minister for Finance in South Africa. Dr. Lawrence Summers, is the Charles W. Eliot University Professor and President Emeritus of Harvard University. Mr. Tijan Tiam, former Chief Executive of Credit Suisse and former Chief Executive of Prudential and former Minister for Planning in Cote d'Ivoire. Excellencies, ladies and gentlemen, it is indeed a special honor and privilege to address you on behalf of the government of South Africa. I'd like to take the opportunity to appreciate all the efforts by the Center for Global Development for your contribution towards the reduction of poverty around the globe and improving the lives of our people through your innovative economic research, enabling good policies and evidence-based practices for the betterment of the world. This session could not be more timely as we consider the devastation of the coronavirus pandemic and as we now begin to do the work of rebuilding our respective economies. What began as a health crisis has now become an economic crisis. COVID-19 has tipped Africa into its first recession in 25 years, threatening to undo 25 consecutive years of positive economic growth. The impact of COVID-19 is expected to see economic contraction of 3.2% in the sub-Saharan African region in 2030, and reducing per capita GDP to levels last seen in 2010. For the first time in decades, extreme poverty will increase, and we have already seen 26 to 39 million Africans who have been pushed into extreme poverty in the last 6 months alone, raising the poverty level by about 6 to 9%. Reflecting on our economic situation in South Africa, the impact of COVID-19 will see GDP contract 7.5% this year. And to mitigate this, we have implemented rescue packages and stimulus packages amounting 10% of our GDP. For the first time in the history of our democracy, we have turned to the IMF for relief. We, along with other 80 countries globally and 35 countries on the African continent, have applied for and received COVID-19 related emergency relief funding from the IMF. Having said all this, I believe as a continent, we have laid down good economic fundamentals that will enable us to rapidly rebuild our economies after the losses we have suffered due to COVID-19. Already made incredible progress across indicators of poverty, health outcomes, educational enrollment, and life expectancy. Countries have invested in their dividends of growth into health, education, and building the physical and telecommunication infrastructure to connect our countries and our economies. We're also just been on track to launch the African Continental Free Trade Agreement this year, creating a single African market and the largest free trade area in the world. This pandemic has presented a once in a century emergency, and no country is unscathed from its economic impacts. As a continent, we therefore recognize the magnitude of the challenge and will continue to confront it head on. It's ever crucial for us to have relevant discussions on effective ways to mitigate the economic and health impact of this pandemic across the African continent, find comprehensive solutions for economic recovery, and steer the ship back towards the objective of Agenda 2063, the Africa we want, which is a safe, healthy, socially integrated and prosperous Africa, free from preventable conditions and premature deaths. And this is what we had committed ourselves to achieve, and the people deserve no less. We're informed that Africa needs $100 billion to effectively respond to the economic shock of the COVID-19 pandemic. We appreciate the current support that we're getting from our partners, the multilateral agencies and the private sector. Some of the key stakeholders supporting us are as member states of the African region to fight the COVID pandemic include the World Health Organization, Africa Development Bank, the Global Fund, Gavi, IMF, Islamic Bank, Bill and Melinda Gates Foundation. I can confirm that about $40 billion has been committed towards the fight against COVID in the continent of Africa, and about $15.3 billion have already been paid out at bilateral levels to different member states. And for this, we're truly grateful for all that support. We're looking forward, therefore, to debt relief for member states, which we believe can be managed by either reprofiling such debts or even cancellation of some of those debts. We convey our gratitude to the G20 for agreeing to halt debt repayment until the end of 2020. And before I conclude, I must take the opportunity to highlight the added burden of corruption, which has unfortunately also reared its ugly head during this crisis, particularly around the issues of price gouging and irregularities in the procurement of PPEs. As the government of South Africa, we've taken a strong stance against corrupt activities during this time when we should be focusing on saving the lives and livelihoods. As a continent, we must stand together to take on these destructive forces and set up mechanisms that fully deter people from engaging in corrupt activity in the first instance. The struggle still continues for the complete emancipation of Africa and her people. We cannot afford to allow COVID-19 to give us excuses to regress from our goals. We must now redouble our efforts as we strive towards attaining the Sustainable Development Goals of the African Union Agenda 2023. I therefore urge all participants in this session to work together to ensure that the economic and health challenges that we are facing in our countries and continent and the world are totally resolved, and that there is full accountability for all the commitments undertaken. I look forward to the panel discussions and also wish you all a fruitful deliberations. Thank you very much.
Thank you very much, Minister Mkhize. I think you set the stage very well. And I must admit, it's always a pleasure to remember that Africa has achieved its federal free trade agreement ahead of many other parts of the world, continents of the world. We turn now to Her Excellency Amira El Fadil to set the stage for us. She is the Commissioner for Social Affairs at the African Union. Are you on mute?
Thank you very much. Yeah. I'm not muted now. Thank you very much, and I would like to say that I'm speaking on behalf of the chairperson of the African Union Commission, His Excellency Musa Faki Muhammad, who delegated me to speak on his behalf. And first, I will start by greeting all of you, our special envoys for the anti-COVID-19 fight, or the envoys here in this event, and even those who are not in as part of this event. We have 6 special envoys of the African Union. I know that 3 of them are part of this very important event. I would like also to thank the organizers and to thank all the participants. My greetings and my start by thanking the Center for Global Development for organizing this event and extending invitation to the AU Commission. As you all know, COVID-19 pandemic is impacting our lives, and there is uncertainty about when it will come to an end. It's also, I would like to welcome my brother and my co-chair of the ministerial meeting for the ministers of health, which is one of the mechanisms we established at the African Union, Dr. Zweli. Sorry for not greeting you. My apologies. I appreciate you and appreciate your work and the chairing and the leadership of your country. In the short run, the public health and social measures that have caused the economies to contract substantially. The IMF, the World Bank, estimate that total African GDP will be 7% smaller in 2020. As a result, governments will be facing the twin challenge of declining revenue against the increasing spending, and this will result in increased borrowing. In fact, total government expenditures are projected to be 2% higher in 2020 than previously forecasted. The debt to GDP ratio will rise on average by 8.7 percentage points of GDP in 2020. These are the expected impacts that's being estimated by the World Bank. This is in the short run. In the medium run, small and medium-sized enterprises, like the SMEs and the self-employed and the informal sector, are particularly vulnerable the expectation is up to 90% of the labor force is in informal employment. This is according to our records of 2018. Nearly 20 million jobs, both in the formal and informal sectors, are threatened with destruction on the continent if the situation continues. In the ILO's latest estimates in 2020, they estimated that 19 million of young populations working in informal sector are at high risk in Africa to lose their jobs, and nearly 64 million adults are in the same situation. Also, in the report of UNECA 2020, estimated that the pandemic could push back 29 million of African people into extreme poverty. Poor households will hardly make a living, already spending a significant part of their earnings on health before the crisis. Poor families will not simply be able to afford healthcare in the wake of the COVID-19 crisis. These also are expected impacts or negative impacts of the COVID-19. In the long run, the crisis being global and the health and socioeconomic impact wider and even deeper for the developing and emerging economies. It is easy to anticipate a fragilized social fabric with the economic recovery forecasted to be slow. It will require twice as much effort for countries to sustain the gains achieved over the past decades. And I will give examples in the fight against the diseases, the area of the human rights abuses, the climate change, and the collective efforts of ensuring an inclusive and sustainable socioeconomic transformation of our continent through the Africa Continental Free Trade Area and more broadly the AU Agenda 2063, all is being affected by this COVID-19. There is a slow down of the implementation of the CSTA. The African Union Commission uh, tried its best to make things going in spite of this pandemic and to keep the deadlines for the ACFTA, the efforts of our chair, Musa Faki, the efforts of the Commissioner for Trade and Industry. The launching of the Secretariat in Ghana was done last month, and we're trying our best to overcome these short-term, medium-term, and long-term impacts of COVID-19. These are just a few remarks, and I will be available to answer any questions, and I will be listening to all the presenters. But I would like to finish by saying that what keeps us optimistic in the African Union that our leaders they committed themselves from the beginning to this fight. They decided that Africa will speak in one voice. They decided on a united efforts to fight COVID-19. They also decided on an anti-COVID-19 continental strategy. They decided on the mechanisms to implement this strategy. They have established an anti-COVID-19 response fund. They have established also the electronic medical supplies platform. They agreed on the pool procurement of medical supplies, and they did it. It's a reality. The COVID fund is a reality. It is up. It's running. There is pledges made by member states. So this togetherness in fighting the COVID-19 and also not ignoring the international partners and the development partners and the effort they are giving to Africa. I'm very optimistic that Africa will continue to be the least affected continent with this COVID-19, with all the challenges we have. I think the way we managed this crisis, learning from our previous experiences, I think Africa is on the track and we are doing well. Thank you very much, and over to you.
Thank you very much indeed, Commissioner El Fadil. I liked Africa will speak in one voice, coming from the African Union. Now, let's turn to the three special envoys we have. Could we start with you, Donald Kaberuka? You are both chair of the Global Fund at the moment, and of course, a former president of the African Development Bank and a former minister of finance in your own country. Um, what is the message you're bringing to the development finance community as a special envoy speaking for the AU? And how are you received? How do you see that message coming back? What kind of a response are you getting? Are you on mute, Donald?
I am unmuted now. Can you hear me?
Yes, indeed.
Thank you, Nancy. Thank you to CDG. Thanks, colleagues, for being here. As Minister Mkizo was saying, there's no doubt that this crisis is a double threat. It's a threat to the gains of the last 40 years, and it is a threat to the future goals and our ambitions. And therefore, the challenge we are having is not simply one of dealing with the consequences of this crisis, it's figuring out how to return Africa to the growth trajectory of the last 40 years. Now, I'll be very straightforward and blunt with you, Nancy, since this is CDG, we're used to speak very frankly. 5 months into this crisis, one thing is very clear. The dichotomy of what major economies are doing for themselves and what they are doing at the global level. Rich countries are pulled out, to use their own language, whatever it takes to deal with the crisis. Borrowing Mario Draghi's famous phrase. They have pulled out massive stimuluses. They've, from a fiscal and monetary viewpoint, they've stretched beyond traditional boundaries to provide the resources. But at the global level, the response has fallen short. Now, this is unlike very much what happened after the global financial crisis 10 years ago. The response is muted, it's not coherent, it is not commensurate with the problem. But here, I would like to exclude, to a large extent, IFIs, especially the International Monetary Fund. Typically, in the past decade, the IMF would do about $3.5 to $4 billion a year. But between the month of April and now, the International Monetary Fund for the whole of Africa has pulled out 24 billion. From 4 billion, 24 billion. This shows you what IFIs can do if given the wherewithal. While we were happy with the decisions taken at the G20 early in the year, I think there have been some disappointment on the debt moratorium. Remember, the moratorium was supposed to be country-specific, temporary, voluntary, and not meant to undermine Africa's access to the capital markets in the future. Now, what has happened is that actually a number of countries have chosen not to participate in the moratorium because they see limited benefits, and they also see a threat to future access to capital markets because of what agencies like Moody's and others have done. Now, I say this because I've sensed some degree of confusion. The debt moratorium was not meant to deal with a debt crisis. It was meant to provide temporary fiscal space in a net present value neutral terms for a year or two to provide fiscal space for countries to deal with the crisis. African countries were very clear, they intend to respect their commitments on borrowers. Now, because of this incoherence in the approach to the moratorium, so many countries are not participating. There is a second problem that the participation in the moratorium has been limited to bilaterals, members of the Paris Club, who are a very small share of the total Africa's debt. Now, of late, other members who are not in the Paris Club are participating, but international financial institutions are not participating. And of course, private lenders are not participating. So this has limited the usefulness of the moratorium, although for some countries it has helped. My second point is on additionality. There is a concern that even where the resources have been provided, not only have they fallen short, but we want to make sure there is additionality, and we want to make sure it is not a rearrangement from future inflows to now. But that would mean once we have dealt with the crisis, when time comes to deal with returning Africa to growth, there will be limited resources. So additionality and then avoidance of front loading as much as possible. And the last point I want to make, my colleagues can make the other points, is taking an example from what happened during the global financial crisis. At the time, the SDRs available were $21 billion equivalent. A decision was taken in the G20 at the time, which brought this to $210 billion, 10 times. So there has been a suggestion by many parties that this crisis is of the same magnitude, if not more, than what we had in 2008 and 2009, and therefore action on the SDRs would be a way to provide a solution commensurate with what we need. That conversation is still going on. It has not landed yet where it should be. We're hearing different things. The envoys have held a conversation with all the countries concerned, but because this thing requires a supermajority of 85%, obviously the position of the US Treasury is decisive. We're having conversation with them, and we're hoping that on this issue we can succeed. So, if I could say this to conclude, this is not a crisis like any other. It undermines the past and it threatens the future for us. We think what the international community, especially the wealthier countries, have done for themselves is exactly the kind of effort, the kind of response which should have been done globally. What we are seeing, therefore, is a dichotomy. Do whatever it takes in the rich countries, do whatever you can do for emerging markets and poor countries. That dichotomy for us is quite is disappointing. Let me end by saying that something else has struck us as envoys. The way at the beginning of this crisis, rich countries were tempted to go back almost to the 1930s. Even countries who had the money in their health budget could not access testing kits or protective equipment because rich countries were not selling the stuff or they were buying it themselves. We are now seeing a possibility that when the vaccine becomes available, that same thing happens. Even when countries have money, they cannot access the vaccines. So this dichotomy on the response, on the dichotomy almost get us back to the beggar thy neighbor of the 1930s is something we're trying to work very hard with colleagues across the world to show them that we'll have to win together in this battle. So Nancy, I'll stop there. These are some of the messages we are passing on with limited success, some success in others. And we're hoping this conversation could be one of those events which help to galvanize the world. But Chidian there and Trevor, I'm sure they can add on what I've just said. Thank you.
Oh, thank you very much, Donald Kaberuka. I think we'll remember the word dichotomy. And maybe this point at the end you make about beggar thy neighbor policies, which we're all suffering from. Also, I think for those of you, many in the audience may not have gotten your point about the US at the moment constituting a kind of block on moving ahead with special drawing rights. Let's turn now to Trevor Manuel, who knows very well the international financial institutions and has worked hard over the years on the governance issues of those international institutions. Maybe to comment on what Donald Kaberuka said or to present your own thoughts about so far the response of the international community to the effort the special envoys are making. Trevor.
Thank you very much, Nancy. Good afternoon to all of you, and thank you to CGD for hosting. I'd actually like to start on the continent, and the first point I'd like to make is about these statistics, because in relative terms, both the infection rates and the mortality rates on the continent are actually relatively low. We've only had 34,000 deaths rising from COVID-19 thus far. 47% of those in the country where Dr. Zweli Mkhize and I live, South Africa. So it's a bit of an anomalous situation, but notwithstanding the low numbers, I think that responding to the call and the leadership of the African Union, there has been a massive endeavor on a whole range of issues. So rebooting health systems country by country has become the first order. And given circumstances where in many countries health systems have been badly neglected, the spending on this has become preeminent. But this has then raised a series of issues, partly because a number of countries are facing debt sustainability challenges. At the start of last year, there were 9 sub-Saharan African countries that were debt stressed, and now a further 8 have been added to that number. So it's a worrying situation. Secondly, I think it's also important to recognize that health spending is wiping out other parts of spending, because part of what countries need in dire economic circumstances is also spending on social safety nets, which becomes very, very important. In many parts of the continent, people are day wage laborers, and so with economy shut down, it's actually accentuated hunger and very deep poverty, and that becomes an issue as well. Needless to say, the major sources of revenue for countries being the commodity exports, impossible with closed borders, tourism revenues, remittances, and then taxes. All of those have been wiped out. So the situation is pretty dire. As Willie said earlier, second quarter South African economy contracted by 51%. Now it's not unusual. In fact, higher on that table would be India and the UK, but 51% in circumstances that confront us here are very, very severe circumstances. None of this are the kinds of circumstances we could have been prepared for. So if you run through the tables of taxes, because of a whole range of decisions that government took, prohibiting the sale of tobacco and alcohol products, all of the excises were wiped out, and with the economy shut down, few levies were also wiped out in the process. So the situation going forward is going to be very tough. I can talk about South Africa in respect of the data sets on revenue, partly because data across the continent is still one of the very challenging features. So for us, the big issues are matters relating to whether we can afford to prepare adequately to deal with COVID-19. I'm saying that the numbers appear low, but we've seen in Europe, in Latin America and elsewhere that the second wave seems to be massive. So on everything, the platform that the commissioner spoke of is very important for us. It was also an initiative introduced by President Ramaphosa. It's run by Strive Masiwa, and it has all manner of equipment, including PPE, medications and therapeutics, and hopefully in the fullness of time, the issue that Donald Kaberuka raised, the vaccines, becomes a fundamentally important issue as well. We need to act together as a continent because we need to have that voice to ensure that we can have an adequate resource inflow. We can prevent the outflow through debt service costs and so on. It hasn't gone according to plan just yet. And then, very importantly, I think we need to build a bulwark against the risks of vaccine nationalism. And these are all issues from the large northern countries. And, so African collaboration becomes preeminent for the success of the venture. I suppose that's what we do as a group of envoys. I'll stop there and we can come back to deal with questions in a moment. Thanks, Nancy.
Thank you very much, Trevor. Let's turn now to Tijan Diam. Tijan spent a lot of time in the private sector. He's familiar with the financial issues. I don't know, do you want to say anything about the response to the G20 debt ideas, Tijan, the weak response, I suppose,
Yes.
that Donald Kaberuka referred to?
Thank you. Thank you very much, Nancy. It's very, very good to see you after all these years. I want to thank again the CGD for organizing this meeting and all the speakers who spoke before me, Mr. Mkize and Commissioner Mira, and my dear colleagues, Donald and Trevor. I can probably limit my remarks because part of our mission is kind of how we work together, and we work extremely closely together between envoys. So I subscribe fully to everything Donald and Trevor have said, and this is our collective assessment of the situation that they presented. We all know that we have a bit of a lull or a strange situation on the continent because the health crisis has not been as bad as we feared. I mean, we of course regret every death, and there's been many casualties, but nothing comparable with what we've seen in other parts of the world. In Africa, it's really an economic crisis that we are facing, and my colleagues have described it eloquently: the drop in export revenue, the drop in tourism, the drop in remittances, the drop in foreign direct investment, the currency is coming under pressure, and the reduction of fiscal space. So the debt service suspension initiative, or DSSI, that the G20 adopted was a necessary but temporary measure, and is not addressing the fundamental issue, which is for us really the financing of the African economy is taken really at a high level. Fundamentally, the continent was doing well. Things like demography, which has also been a positive against COVID, but the youth of the population, the growth that allowed, has allowed real progress over the last 20 years. And we are very, very worried as the equity markets are very strong. The efforts made by the developed economies is out of proportion, absolutely record. But we just, Africa ends up being the only casualty of this, and is forgotten as the rest of the world returns to growth. So we've been very strong advocates of the need for fresh resources. Donald talked about the SDRs. I can only reinforce that. We are really pushing very hard for special drawing rights reallocation, which could free up significant resources. And we think we're making progress. The latest news we have is still relatively early days, but it looks like we're making progress on this. And it could be a big part of the answer, because the DSSI is not fresh money. We need material, new resources. The lowest estimate we've given is $100 billion per annum for 3 years, so 300 billion. And if you compare that to the kind of stimuli we have seen across the world, it sounds like a relatively modest sum for a continent of 1.2 billion people. And importantly, we also have to ensure that the hard-earned market access that a number of African countries have now, being able to tap debt markets, issue sovereign bonds, remains, and is not another casualty of this crisis. So really addressing also the issue of debt is very important. so that there is no contagion effect, and so that all the progress made, as I said, can continue. And it's important to distinguish between the countries in thinking about the debt, because some countries were doing well and are well managed, and they are hit by a completely exogenous shock. I mean, there's no way there can be any kind of blame attributed to them. So the whole moral hazard discussion that usually goes with those issues is not applicable here. Those countries deserve to be helped and should be helped almost unconditionally. And you have then countries that were under pressure or are less well managed. There we need to look at the debt restructuring along the usual and classical lines, and that can be done. But it has to happen relatively quickly, because as my colleague said, the deceleration of the economy is very strong. You went from a strongly positive number to quite a negative number. So the delta is very big in terms of how it's going to be felt by companies, households, etc. It feels like a very severe recession, and we don't want to, the African economies, to have permanent damage from something that is completely exogenous and in which they have very little responsibility. So the last thing I'll stress is really how I think well Africa has responded. I think my colleagues have said this. I can only emphasize it, the role that the AU has played with a special envoys. We cannot overstate the level of engagement of the heads of states. We basically have a call once a month with them, and there's always 15 to 20 heads of state attending. So that's level of collective action I don't think has been seen in Africa before, and the AU has played a key role in making that happen. And I think actually it's a potentially a big strength for Africa, but we don't lose the kind of muscle we've acquired through this exercise. It can help in any number of situations, not just COVID, and the functioning of the institutions is very comforting. So, and you see that Africa has achieved now for the PPE and the equipment something that I believe other regions have not achieved, which is to be able to pool the countries. We all talked about this platform. It's actually been developed by a Senegalese woman who's like 30 years old, who did all the coding. We have an electronic platform where all the countries can share their surpluses and make them available to other countries. So this kind of collective approach has been very, very effective. We have an agreement with suppliers, including in China, so that we can procure the equipment at a very competitive price and at better terms than each country could access them individually. So all that is on the positive side, and that's been very encouraging. But I'll stop here and give you the floor back. Thank you, Nancy.
Thank you to John. Yes, it's very striking, the collective approach. And I'm struck, $100 billion for 3 years compared to 3 trillion in the US or 2 trillion, 1 trillion in Europe. I think it's a good time to turn to Larry. I'm remembering that Larry, among many other good things in his career, was the chief economist at the World Bank. We haven't heard much about the response of the World Bank and the other development banks. I don't know if you want to say anything about that, Larry. There is maybe a contrast with the response of the IMF. But over to you for your thoughts and comments on what we heard from the envoys, the special envoys.
Thank you very much, Nancy. It's a pleasure to be with you and CGD. It's a pleasure to see again my old finance minister colleague, Trevor Manuel, after some number of years, to again be in a conversation with Donald Kaberuka, who did so much as the head of the African Development Bank, and to be engaged in dialogue with my friend Tijan, who I've known for so many years, along with the other distinguished colleagues on this panel. I am not entirely sure why I am here. Everyone else on this panel is a distinguished African and a distinguished expert on matters relating to the African economy. I am neither of those things, so I speak with great and perhaps uncharacteristic humility. Let me just make a few observations. First, the US election will be enormously consequential for all the outcomes that we are discussing, and enormously consequential far beyond issues of African economic development. This is by far the most consequential US election in my lifetime, and the global system that most of us know, all of us know, and most of us, for all its flaws, greatly value, is very much at stake in the context of the current election. Issues that are near impossible in the current political context will become quite easy, I predict, in the context of a change in the US government. I think, for example, of SDRs. I think, for example, of freeing up of lending from the development institutions. I think, for example, of generous approaches to foreign assistance. Second observation, there is an overwhelming case for a substantial increase in the resource commitment to Africa, to emerging markets, and the developing world more broadly. One has to be struck by the extraordinary and unique boldness of the domestic response in the United States, Europe, and Japan to this crisis, and the timidity, tepidity, and timorousness of the international global response for developing countries. Let us not be confused about what is at stake. The defining reality for thinking about economic development of the first 35 years after the Second World War was divergence. Rich countries grew faster than poor countries, and the gap between them widened. The defining reality for the last 35 years has been convergence, as developing countries have grown more rapidly than industrial countries and have closed the gap. That is why the last 30 years have seen more progress for more human beings than any 30 years in human history. What is at stake in the next years is whether that process of convergence can continue and does continue. It is under threat, yes, from the pandemic. It is under threat, yes, from concerns about international trade. It is under threat from technological developments that may tend to concentrate production and economic activity in previously prosperous hubs that already have agglomeration economies. But above all, it is under threat from a politics of an unfettered return to economic nationalism. And what is at stake is the idea of global community. And there can be no global community without a strong African presence, without Africans doing their part to grow, prosper, and enter the global community, and without the global community responding. How we respond in response to COVID will be an immense test of all of that. Third observation, there's a word that has been strikingly, at least to my mind, absent from the dialogue so far, and that is China. China has an immense presence on the African continent. China has extended immense loans to the African continent. China has judged itself to have a substantial economic stake in developments on the African continent. There is room to debate whether Chinese policies reflect a enlightened, if non-Western, approach to promoting economic development in the mutual interest of all, or whether there is an element of selfish exploitation, debt trap diplomacy, subversion of positive trends implicit in China's economic activity. That is a debate for experts with much more texture of experience on the African continent than I have to participate in. What it seems to me is unquestionable is that reflection on Africa's economic future must involve China as a central player. Chinese money, Chinese technology, Chinese debt collection, all of this will be central. And I do not presume to judge or evaluate these issues beyond making this observation. For the West, for the traditional international financial institutions to cede relevance in Africa to China would be to take a remarkably short-sighted view of our own interests, would be to weaken the position of Africa, and would be a tragic error of historic proportions. Again, I do not presume to judge how all this should work out, but we cannot any longer suppose that the dialogues that normally take place in the G7 or within the international financial institutions constitute a dialogue among all the important external actors with respect to the African continent. And I don't think that is an idea that has been fully recognized in the city of Washington. Fourth, what should be done? One, it is a no-brainer that an SDR allocation should be passed. My own preference would be to pass two $500 billion SDR allocations staggered over a period of a year or two, so as to avoid the need for US congressional approval. Two, that SDR allocation should be associated with an agreement among willing parties to reallocate the SDRs for the African continent. Three, the World Bank should, and the other development banks should come into the 21st century in terms of their financial engineering. It should be recognized that levels of leverage that have evolved substantially in the private sector in recognition of the remarkably low level of interest rates need to be expanded within at least most of the development banks. I am confident that it is, as CGD research has convincingly demonstrated, that it would be possible to substantially increase lending limits from the World Bank without putting the health of the World Bank in jeopardy. I suspect that the same is true for at least some of the other major development banks. Fourth, there needs to be a recognition, and this would be a good, very valuable thing for CGD research to document in detail, of the reduction in the value of concessional assistance associated with low interest rates. A zero interest rate loan when the treasury rate was 6% for 30 years was a very substantial grant in present value terms. When zero interest rate loans are provided at a time when SDR interest rates are close to zero, the concessional element is far smaller. There is no reason why all of that reduction should be enjoyed by the donor countries, and none should benefit, and none of it should benefit the recipient countries. Concessional aid calculations should reflect the reduction in concessionality associated with declining interest rates. Fifth, the world needs to organize itself around global health. Yes, as I've told global health groups, when there is a new major crisis in the sphere of global health, inevitably, as vital as it is, a portion of the resources are going to have to come from ongoing and existing global health priorities. But there is no reason why that should be the main or primary or large scale source of financing for the enhanced global health effort that COVID demands. Malaria relief is no less a priority today than it was a year ago. The same can be said with respect to tuberculosis. The same can be said with respect to AIDS. The world needs to be prepared to step up in a cooperative way to meet the global health challenge. When future historians evaluate the morality of this moment, who got vaccines when, and how linked was that to poverty, will be a question on which moral historians will judge us. Finally, there is a critical case, not on large scale tomorrow, but there is a high likelihood that over time, substantial debt relief will be necessary for the most affected and indebted countries. How much and in what way will depend upon how the virus evolves and will depend on how the global economy evolves. But these things take time, and now is the time to begin planning for the kind of comprehensive, though case-by-case, approach to debt relief that was successfully implemented around the time of the millennium and is likely to be necessary again. I have been engaged in matters of international financial diplomacy now for a generation. I can think of many cases in which debt relief was delivered too late, in which failures of realism, failures of recognizing reality led to burdensome, costly debt overhangs that affected the health and education of millions of people. I am not aware of a single instance in which observers have looked back and said debt relief was premature. Debt relief was excessive. And that is a lesson that we need to heed as we think about debt relief for Africa going forward. Let me end where I began. For better or for worse, for fairer or for less fair. Much of this is going to depend on decisions that are made in the United States. And as President Obama said in a very different context, elections have consequences. And how Africa is responded to at this crucial moment will be one of the consequences of the US election. Thank you for the chance to be with you.
Thank you very much, Larry. You said many things. I'm sure the other speakers have reactions. I certainly have reactions, especially on your first point, of course. But let's see, maybe gentlemen and Amir El-Fali, just put your hand up if you want to respond to any of the points that maybe let me mention. I was particularly struck on one point because I think Donald Kaberuka, you're chair of Gavi right now. I heard on the radio just today that basic child immunizations are way down around the world. So that's one example where that we haven't talked about the implications of COVID for other health. We also haven't heard much about the idea of global public goods, except in the context of Larry's invoking the international community. You want to put your hand up? I think I can see all of you.
Yeah,
You're struck dumb by our problems in the US, where Larry started. Amira?
Is up?
Or speak up, unmute yourself and speak up. Go ahead, Amira El-Fadil.
Is it up?
I think you might be on mute. Should we turn to Tijan? Are you trying to say something?
I think Donald had his hand up first. No,
Donald, go
I'll
for
go
it.
after.
Am I muted? Thank you. Thank you, Nancy. Let me first of all say that Larry's points are absolutely to the point. I mean, the analysis is made is one I was referring to at the beginning about how the global response is so muted in the light of all the things he has mentioned. And also, I do think the things he has proposed, SCDR's reallocation, DFIs, and his point on concessional financing are all valid, but they all require leadership. We have been very impressed by the current leadership of the International Monetary Fund. And so I'm hoping that going forward, either within the realm of rich countries, G8, we'll see the kind of leadership which Kristalina has demonstrated. I think all these things are doable. All these things are possible, but they require that there are some leaders on top of those countries, those organizations, prepared to see the agents of the things which Larry has just mentioned. Now, to your second point, Nancy, about I'm not chairing Gavi, I chair the Global Fund.
Right.
Ngozi
Okonjo-Iweala, the other special envoy, is chairing Gavi. Yes.
Yeah. What the Global Fund has done, and Zweli Mkize is here, is that we've considered that COVID is a threat to our fundamental mission, i.e. HIV, AIDS, malaria, and tuberculosis. And therefore, we provided countries with additional resources from that angle of safeguarding our mission. And therefore, Larry again is quite right to say that when there's a pandemic, you don't shift furniture on the deck. You look for additional resources to be able to protect that mission. There are more children who will continue to die of malaria in Africa, probably more than this particular pandemic. So it would be a mistake to shift resources from malaria, tuberculosis, HIV/AIDS to deal with this pandemic. And this is what we have done in the Global Fund to avoid that kind of happening. But I do agree that who knows what will happen in the future at a time when the domestic revenues will be under pressure, where domestic expenditures will be increasing. We'll have to figure out a way in which the international community can mobilize its will. And SDRs, along the lines Lara has mentioned, is absolutely the low-hanging fruit. Thank you.
Thank you, Donald. Anyone else? Yeah, Trevor. Trevor, and then Minister Mkhize.
Thank you very much, Nancy. Thank you very much, Larry. That was very illuminating. The one point I'd like to lift is perhaps to step out of the kind of diplomatic space we're in. Everybody's been talking. Donald has amplified the role of Kristalina and the positions of the IMF. Now, for those of us who've kind of worn the carpets thin in DC on our regular travels there, it comes as a bit of a surprise that the gap between where the bank is and where the fund is has grown to such an extent. And this is very, very worrying because the mandate of the bank allows it to actually deal with the issues of reconstruction and development. And it would appear that the bank is walking away from this. We're battling to get all of the numbers out. Perhaps CGD can put that into its research mandate as well, to ensure that, because there's a sense that inflows by way of debt service into the bank from Africa now is greater than support from the bank to the African continent. Now, it's not an idea that should even enter the domain. But what is very apparent is that there hasn't been the same thinking about the need to bring the bank, hopefully not kicking and screaming, into the 21st century. The bank is needed now more than ever. And in the absence of the bank rising to the fore, I think that there'll be desperate measures, and this will also impact. Now, probably as a consequence also of what happens on the 3rd of November in the United States. But beyond that, I think it's also asking the tough questions about the global governance of the bank and its ability to provide relief and support right now. And it's about dealing with the exigent issues, but also building a platform for countries to recover more quickly. Thank you very much.
Thank you, Trevor. Before we go, I know to the next person who had a hand up, I've already lost it. Want to remind the audience members that you can submit questions via YouTube, on Twitter using the hashtag CGD Talks, or by emailing events@cgdev.org. Minister Mkhize.
Thank you very much, Nancy. And I want to say that the comments from the panelists have been quite refreshing, and also I agree with quite a number of them. It does require us to be fairly bold. I think where we sit, we are in a position where we could actually lend a voice to those authorities that should be in a position to assist in improving the response, particularly on behalf of the African continent. One of the experiences that myself and my co-chair, Commissioner Amira, were to face was a challenge of the shortage of a lot of requirements, health requirements, health commodities, which I would say at this point, it's important to start motivating for a strategy that will assist to build the capability within the African continent for manufacturing of the diagnostics, the therapeutics, the vaccines, the PPEs, not as a matter of just a kind of donation. We're talking about a proper investment where we actually get a lot of these companies to come and build those capabilities in the continent. The difficulty that we've had to go through trying to source, when we found that most of the countries actually are not even able to host any of the particular companies that manufacture all of these requirements, has been frustration. And if there's any legacy out of the COVID or of our fight against COVID-19, must be improvement in the capability of manufacturing a number of these requirements. I think it's something that we need to work on and fight for, because suddenly we found that the continent, as a continent, we're on our own. And it had to actually mean that through Africa CDC, a whole amount of mobilization had to be worked on. And of course, the chairperson of the AU platform, of the AU, President Ramaphosa, assisted us with the platform, that the procurement platform. So I think that's one issue we need to talk about. The second issue is that the message that had come from the G20 from last year and and this year has been how we need to tie up very closely the working of the finance ministers and health ministers in order to improve the resilience of the health systems and move towards the provision of universal health coverage. Now, that remains a priority, which should not be derailed by the fact that all the countries, particularly in the continent, have had to spend all their resources in a whole lot of other manner of things in response to COVID, and therefore this begins to suffer. It's another issue that I think is very, very important. Then the third issue has been the question of the drawback that comes as a result of the COVID-19. The fact that there was a reduction in people who are coming for diagnosis and treatment for TB, for HIV, basic immunization that had been at a very high level of achievement started getting to be reversed. And all of this becomes important because all of a sudden, you will actually find that we would have mounted such a strong fight against COVID-19 and lost lots of lives as a result of diseases that would already began to overcome. Indeed, true, Donald, as Donald saying, the Global Fund has actually added resources. Other funders, PEPFAR and so on, have also responded in the same way. I think that's the best way, the correct way to respond, because here we needed to actually put additional resources to be able to assist countries to be able to respond. Now, there's an issue of the vaccines that are coming through. The real challenge is that our inability to get all the countries to be able to have access to vaccine may actually spell disaster for the whole world, because immediately in the first year or two, we are not likely to be able to get beyond 20% of the global population in terms of vaccination. So which actually means that any part of the world that remains exposed with low immunity still possesses a chance to cause the explosion of the resurgence of the infection because of all the borders will open, and of course trade will be normal. It's actually a huge risk, and that it becomes important for us to be saying there need to be support for all the countries, and the issue of equitable access to affordable vaccine becomes a major point that needs to be supported. I think a strong point needs to be made as well, that this debt suspension is a very important coping mechanism for many countries. And therefore it will be disingenuous for rating agencies to create uneasiness on various countries, because it's not a default in payment of the debt, But it's a question that there's additional pressure that all the countries are going through as a result of responding to COVID-19, both in terms of managing COVID-19 itself. It shifts a lot of resources, but in addition, a successful response will actually need that reinvest on the health services in terms of the infrastructure, in terms of the human resources and equipment and so on. So that becomes a problem. Now that takes away a lot from other developmental priorities, education, various other issues. So our point, therefore, would be that COVID has caused a lot of pressure on domestic revenues. It has also caused a lot of difficulties in the GDPs of various countries. And from that point of view, a lot of support is needed, particularly for the continent, not to fall behind. Thank you.
Thank you, Mr. Minister. Let me follow up something you said and address it to any of the special envoys. Larry Summers raised the issue of the World Bank not doing very much about sweating its own capital. And he also, in that context, referred to the concessional window at the World Bank not moving particularly on managing net flows to the continent, given that the multilateral banks are not included in the G20 DSSI initiative, which Donald Kaberuka mentioned at the beginning. So there's been actually quite a debate among and within CGD about whether the World Bank should join in the debt moratorium in some form. But the problem then comes up of China, which Larry also raised, that there's a concern that the World Bank, IDA, would be doing a debt standstill for cheaper money, cheaper loans than the bilateral loans of China, which hasn't come through that much yet on the DSSI. Does anybody want to make a comment about any of that? I mean, this is about collective action at the global level that is not even close to what we see in terms of collective action in Africa.
Well, I'll jump in maybe, Nancy, and my colleagues will complete what I'm going to say. But I think the World Bank point is very important. I mean, we feel very strongly. It's the first time in my years of being involved in these issues that we all praise the IMF and are quite critical of the World Bank. I think Larry is right. I think that their whole approach to their balance sheet management needs to be fundamentally reviewed, but they could do much more for Africa, because the other issue is that if you look at our countries, we don't have a lot of instruments. The size of the balance sheet of our central banks is such that a lot of the things that other countries can do, we cannot do. And the World Bank and the IMF are in a unique position to complement, if you wish, the financial tools that a normal economy has for us. And when there's a failure there, the cost is enormous for the economy. So this, and I think the CGD can help, but the intellectual discussion on this needs to happen, and the approach of the World Bank just must change, because it's intolerable to have negative net flows with Africa today. We have, as envoys, we've had several discussions with President Malpass. He's made himself available, I must say, but we have not made the progress we hope to make there. And this whole issue of cross-subsidization through the DSSI, if you wish, is very important, because there is the World Bank, there is China, but there's also the commercial creditors, kind of my old profession, who have absolutely made no concessions. We've had multiple meetings with them too, but we end up with a situation where basically taxpayer money is going to cover the payment of the interest of private of the commercial creditors, which really is also questionable. And I think at different times in the past, the governments have been able to apply more pressure, I think, than they have so far on the creditors, because today about half the debt is basically commercial debt for Africa. It's become a huge issue. So we're spending an enormous amount of energy on sums that are relatively modest and not tackling the big kind of elephant in the room. And also, I just like also to reemphasize this whole issue of there are not that many deaths from COVID in Africa. I think maybe, but there are a lot of indirect deaths, as many have said. The opportunity cost of all this is very high. People are dying of other things, while they're not dying of COVID because of the cuts made in the spending. So back to Larry's point, and that's my final comment. There's no case in history where debt rescheduling has been premature. I mean, really, I want to just stress the urgency here, which we don't feel, because there's a lot of commotion at the beginning, but the crisis in the end, economically in the developed countries, has gone better than expected. The equity markets are, at historic highs, etc., etc. So that sense of urgency that we felt 4 or 5 months ago, the momentum that led to the DSSI is disappearing, and that's a big risk for us. So we need to continue the advocacy and continue pushing on all those themes. Thank you.
Thank you to John. So is there any hope for more pressure on the international, on the World Bank and the African Development Bank for moving ahead, as Larry suggested, on debt relief? HIPC 2.0 would not be premature to do. Trevor?
Nancy, I think there's no doubt that we have to keep at this issue. And as Tidjane said, we've had a number of meetings with David Malpass and his team already. And we have to keep going at it. The key would be the G20. And hopefully the G20 will ensure that everybody comes on side. And we need to ensure that the bank and the fund come on side. The African Development Bank is likely to be less of an issue. There are a few matters, I think, that have now been settled. Those were internal matters, but the African Development Bank is less of an issue. We need to get the World Bank to ensure that there's a signal, and that's actually what we haven't been able to prize open as yet. We've set a very important deadline of the annual meetings that gives us a few weeks to get through the issues, and hopefully we can get there.
And what about China, gentlemen?
Donald, perhaps you led us last week.
And Larry put his hand up. Donald and then Larry.
Thank you, Nancy. The envoys had working meetings with Chinese officials 10 days ago, I think. The Exim Bank, which accounts for 75% of all the lending, is participating in the moratorium. And as you know, China's total debt in the countries which qualify for the moratorium would be about 54.7 billion, which would be 20% of the total. So if we can get Exim Bank participating, which they said it is, that would be a big step. Why I think there is a problem is that they define China Development Bank and the ICBC as private banks. And therefore, they don't see them falling into the moratorium sphere. What they say is, if the private lenders in other countries provide the moratorium, China Development Bank and ICBC will, comparable terms. But from now, their own internal definition of the China Development Bank is that it is a private bank. And people in the US Treasury believe that it is not a private bank. So that's why the arguments are. And I think the fact that the Exim Bank is participating is quite encouraging. But they make a point also, Nancy, which I think you and Larry have mentioned, that actually in their relationship with Africa, they are more interested to see how to continue financing development in Africa post-COVID in terms of additional resources. You see, the moratorium is a small fix now to deal with the crisis, but they asked us to reflect on all the future financing arrangements with China could be, and we will be doing that.
Very good. Larry?
Let me make 2 points, if I could. The first is that it is right to a substantial extent to focus on annual net transfers and to say that providing new money is a substitute for writing off old debts, and that in many circumstances it can be better. The problem is when, as so often happens, the prospect of new money is used as a reason not to write off old debts, and then the new money is not delivered.
Happen. Right.
And so, but we need to be careful not to become formulaic about debt relief in ways that challenge the prospect of getting new money that would otherwise be delivered. That's why my guess is that the right approach with respect to the MDDs is more around new money than it is around writing off old debts. And we need to be pragmatic in our approach to China in being willing to accept new money as an alternative to debt relief. We just need to insist that it be one or the other. And the tradition of we can't relieve debt because then there won't be any new money, but actually the situation's pretty hopeless, so there won't be any new money anyway, is the situation that's unacceptable. But I think the good guys on these issues do have a tendency sometimes to fail to recognize that genuinely provided new money is a really important positive contribution. I know nobody on this call is making that mistake. The second point is, I think we need to be realistic in our timing assessments. If the Chinese were going to take a major step towards multilateralism, why would they do it a month before the US election for an administration that they thought was more likely than not to go out of power? If the World Bank's president was going to change his broad perspective, why would he not to a direction that was more congenial to a new US administration? Why would he not work that out with a new US administration? And so I think reality is that intense advocacy for major action a month before the major players' general election is not entirely realistic. And that the better approach is directed at making sure that a new American administration will understand the important areas where it can deliver fast results, making sure that the other major European shareholders have an idea of what kind of direction things should move, and contingency planning against the possibility that the US election goes in a direction that we would not prefer. But I think to hold out the prospect of highly consequential action at the annual meetings is, rather than an evolving climate of opinion, is probably not entirely realistic. I wish it weren't that way, but I think that is the way it is. And I think people need to understand that not every moment can be the most important moment, and holds some firepower for a global convening that I think is likely to take place very early in a new administration.
All right. Well, I see that we have run out of time. I thought this was really, an impressive conversation in many ways. I can send congratulations to the AU. and to the special envoys for what you're doing. And I think we should end with Larry's point. Please push on well past the annual meetings coming up soon. Push on well past November 3rd, whatever happens in the US. I think it's most unfortunate that what happens in the US is so critical to what happens in Africa and the world, but that is the situation we're in. Many thanks to all of you, including Minister Mkhize and Commissioner Amir El Fadil, and to Donald Kaberuka, old friends, Trevor Manuel, old friend, Tijan Tiam, old friend, and Larry Summers. Thank you all.